Do you want to know the single biggest mistake made when treating eczema? Here are some of the before and after photos from our clinic. Please give me a thumbs up if you like them. Today we'll be discussing why you get it and other people don't, how is it diagnosed, how to treat it, and at the end I'll disclose the single biggest reason that people's treatments fail. So what is eczema? Eczema is a chronic relapsing inflammation of the skin. It leads to dry skin, it's quite irritated, you tend to scratch it a lot. It can lead to pus, which is a secondary infection taking place as well. Who gets it? So about 15 to 30% of children get it, so it's quite a large percentage of that population. However, most people do grow out of it. By the time you're an adult, only 1 to 2% of the adult population has eczema. So why do you get it? It's divided into two main causes, genetic and environmental. So let's talk about the genetic factors. Why do you get it and someone else doesn't get it? 50% of this cause is reduction in NMF factor. So that's your natural moisturizing factor. What is NMF? Why is it so important? The reason it's important is because it allows your skin cells to retain water. If your skin cells do not retain water, water evaporates from your skin. And when that happens, the pH of the skin rises, and the enzymes in the skin basically allow the top layer of skin to separate. So guess what? You've now got almost gaps in your skin, which allows irritants to come into the skin, but also more water evaporation. It is a vicious cycle. If you're finding this useful, please can you write in the comment section the word yes, so I know that I'm teaching you what you want to know and I can do follow-up videos for you as well. The second genetic cause is a reduction in antimicrobial peptides. So we've all got these things on our skin, which basically are almost antibacterial peptides. If those are reduced, then it basically means you have more bacteria on the skin. The biggest one being Staph aureus. Now, Staph aureus produces a toxin which leads to inflammation. And if you remember that you've almost got these gaps in the top layer of skin because you've had more water loss, then it leads to more inflammation and more irritation. So that's another big reason why genetically you're more susceptible to having eczema. You may also have increased serum IgE antibodies. What does this mean? It basically means that you're susceptible to not just eczema, but also asthma, hay fever, and allergic rhinitis. So let's talk about the environmental factors. What can you do to physically help yourself? There's not much you can do about the genetics, but there are definitely things that you can do to make your life easier. So the first thing is your biggest enemy is soap. Soap is an emulsifying agent. This means it literally strips your skin of fat, of the lipids in the skin. This means that that lipid barrier that is allowing your skin cells to retain water is not working effectively. And so water evaporates from your skin, and guess what? Further exacerbates your eczema. So what should you be doing? You only use hydrating soaps in specific areas. So those are your private areas and under your arms, and also if you've specifically soiled a part of your body. Other than that, please just stick with water. I know right now you're probably wondering, water is not enough to clean my body. Don't worry, I've done a whole video on the skincare routine you need when you have eczema, so I will link that below, and also it'll probably be on your playlist next. The second biggest cause are dust mites. Dust mites produce a protein that directly damages the protein in the skin, and that can also lead to inflammation. So on that front, there are a few things that you can do to help yourself. Number one, wash your bedding at over 50 degrees Celsius. For me personally, I have leather sofas and wooden flooring specifically for this reason. And I also tend to prefer blinds as opposed to curtains. For me personally, my 2-year-old son is prone to eczema. So what I do is my sofa's are leather, my flooring is wooden. I tend to prefer blinds over curtains. And I'll also be talking later about skincare routine for children who get eczema, because that's slightly different to adults. So how is it diagnosed? It's a clinical diagnosis. And you have to fulfill certain criteria. So number one, you would have itchy skin. You would have itchy skin plus a couple of the following. Number one, general dry skin. Number two, a rash or inflammation in specific areas. And number three, a history of hay fever or asthma. So what do you see on examination? You have dry, scaly patches on the skin. You have scratch lesions because obviously it's very itchy. And also, if you've got skin of color, it leads to pigmentation. So this is very, very common. And often it's the pigmentation that affects someone's quality of life more than the actual eczema itself. The last thing that can happen is because you've actually opened up the skin, you can have secondary bacterial infection that can lead to weeping or pussing of the skin, which is obviously quite painful and should be seen to. So that's all great, right? But how do you treat it? It's threefold. Number one, you want to improve that skin barrier. Number two, you want to reduce the inflammation that's taking place in the skin. That's what's leading to the pain. And the third thing is you want to reduce or prevent any infection from taking place. If you do those three things, you'll feel far more relieved and you won't be going through this constant trauma every day. In my next video, don't forget, I'm going to be going through into far more detail the products that you want to be using on your skin. So don't forget to subscribe so you get access to that first. Okay, so after you've come out the shower is when you hydrate your skin. So you're going to apply a nice thick emollient cream, stroke downwards. Don't forget, you are wearing the thickest creams that are on the market, and you're going to be applying them far more times than the average population throughout the day. And you do not want inflammation at the base of every hair follicle. It's just an additional headache and more inflammation on the skin that you don't need. So remember to stroke downwards to prevent folliculitis. Wait 30 minutes, and then if you're having a flare-up and you're meant to be using your anti-inflammatory steroid cream, apply it at this point. Why do you wait 30 minutes? The reason is you don't want to dilute the steroid cream by putting it directly on top of your hydrating cream. So that's one reason, but the other reason is stability. So you don't know how stable the steroid cream is going to be with your moisturizer. So that's why we like to give it a bit of a gap. Now, if you've got severe dryness and severe itching, but there's no secondary infection or secondary bacterial infection, you can bandage that area at nighttime to basically give you a second skin to further occlude that area. So you are, again, trapping water in the skin. It is going to be very beneficial to you if that is what your skin is like at that moment. I'm not sure how many of you would like me to do an extensive video on steroid cream specifically for eczema. If you do, please can you write it in the comments section below so I know to do that for you. Another thing that you can do if you're older than 6 months old is use antihistamines. They are going to help you when it comes to the itchiness, but also when it comes to sleeping. A lot of people actually become so itchy that they find sleep difficult, and that can almost trigger further eczema. So you also want to break that vicious cycle. And lastly, fragrance-free is your friend. This comes to everything from your cosmetics, your skincare, but also your detergents specifically for bedding. So make sure you choose fragrance-free detergents. That's really important. And I also recommend you don't wear synthetics or anything else that's going to irritate your skin. I would probably choose cotton or more natural fibers. So what is the single biggest mistake that people with eczema make? The single biggest mistake is that they apply Vaseline to the skin and think that they are hydrating the skin. The reason this is a mistake is because Vaseline is an occlusive. It basically stops any more water from evaporating from the skin, which is good, but it does not draw water into the skin. So what you should be doing is using humectant ingredients. A humectant is basically a molecule that draws water to it and hydrates the epidermis, the top layer of skin. So my favorite ingredients would be things like glycerin, hyaluronic acid, urea, lactic acid. Specifically for eczema, the ingredients I would look for are glycerin and hyaluronic acid because they're going to irritate you the least. Once you've applied your humectant cream, then you apply your Vaseline or petroleum jelly or any other occlusive on top to make sure that you're retaining that water. But if you don't retain the water at the beginning and you apply that barrier cream immediately, you are doing yourself a disservice. You're not going to get the results that you want. I hope you found that helpful. If you did, please give me a thumbs up. If you feel like this would help somebody else with eczema, please share this video with them. In addition, I am creating a guide, a free guide for skin of color, tips for skin of color. If you want to download that, you can, and the link will be in the bottom. Thank you very much for listening, and I hope to hear from you soon.